Hemochromatosis, a word that I almost could not even pronounce. It's a higher level of iron in the blood. Hi, my name is Sam. Hope everybody's doing well today. Today, this video, I want to talk about hemochromatosis. It's something that I just kind of recently found out I have a little bit of little overloaded in iron rather than normally people hear low iron deficiency as in anemic, but in my case recently with the blood test came out that iron is a little bit more than it should be. Disclaimer: I'm not a doctor nor a medical professional, so everything in this video I talked about are medical conditions that I am experiencing or have experience of in the past. If you have any medical concerns, medical questions, please refer that to your doctor for the best advice. Thank you so much. So, what is hemochromatosis? Hemochromatosis is when the body builds up an additional overload in iron. It cannot expel it like um, normal other people. Now you hear about iron deficiencies and low irons is when people are anemic. Their red blood cells are not as big as it should be, and they're having a hard time carrying oxygen to the other part of the body. But this is in reverse. It's actually more iron than you need in the body. And irons, as we all know, is actually plays an essential part in the body. It carries your oxygen to other part of the organs, so you can function normally. With the overloaded in iron saturation, your body can have all kinds of problem as well. It's not just your body cannot function when you're anemic, but when your body is overloaded with iron, it can cause all kinds of problem to your liver, to your heart, to your pancreas, your kidney. Um, all that other stuff can cause problem as well. Now this diagram shows you can get vertigos, hair loss, memory loss, heart problems, uh, especially the liver. Liver, you can have fibrosis, cirrhosis, because there's too much iron deposit into the liver. It can also cause your pancreas to have problem. When that has problem, it cannot control your blood sugars. So you're gonna have blood sugar problem, and that can affect your kidney, can affect your eyes. Um, yeah, all kinds of problem. You can be diabetics, and all kinds of problem. When you have hemochromatosis, your skin will turn brownish, copper kind of like color instead of the yellow jaundice like liver issues. And I'm not talking about Iron Man kind of color. So symptoms of iron overload is you're getting almost very much the same as getting being anemic. Fatigue, nauseous, weakness, abdominal pain. It's probably the the issues with the liver. Um, Diabetics have actually have caused any pancreas problem. Liver failure, like I mentioned a little bit earlier. Heart failure. When there's too much iron deposit, it can affect the heart as well. It's hardening the heart chest wall. Um, impotence is losing your sex drive. Woman probably losing their um, menstrual periods and all that stuff. Joint pains, arthritis, and all that stuff. Memory fog. I mentioned browning of the skins, and as well as weight loss. And actually, recently, that's what is happening to me. Is I actually kind of lost a bit of weight and made me a little bit concerned. That's why I actually went to the doctor and get some blood tests. And I mean, everything checks out fine except for the little iron that actually is a little bit high. So, hence, I've been looking up in the internet and see what that is. And there's it's telling me it's more like when you have overloaded iron, the condition is called hemochromatosis. But um, speaking to a doctor, which I actually saw recently, I saw a blood specialist doctor. Um, he doesn't think it's an issue. He thinks that it might just be something that just kind of spiked up a little bit. When I do run the test in 3 months again. He also mentioned that what can affect the condition is the ankylosing spondylitis, rheumatoid arthritis. This autoimmune condition can also mimic some kind of issues like that. Um, it could probably a false positive that kind of spiked up the iron a little. But there's other numbers that he needs to see to be sure. So we're gonna have to run that test in 3 months. But he actually assured me that he doesn't think that it's an issue. He doesn't think that I would have an additional problem. So which actually gives me a lot of relief. So as you can see, symptoms of overloaded iron is very much the same as low iron deficiency. Where low iron deficiency you have an issue is that you're gonna have a lack of energy doing exercise, as well as short of breath, or it cannot carry enough oxygen for. Now the causes of hemochromatosis. The main cause is actually more of a genetic issue than anything. There are what I was looking at, it says there's probably 1 out of 9 people will probably have some kind of iron deficient, iron overload. Most likely you won't know about it, and many people do not have an issue. But within that percentage, 1 out of maybe 300 or 200 something people would actually have issues. So that means the overloaded iron will cause problems with them. So the average number is very low, but still there are people that would have this condition. Um, like I said, primarily it's more of a genetic issue. The secondary is, people who are taking too much supplements, too much multivitamins, as well as eating too much red meat, um, too much taking too much vitamin C. And I'll talk about it in a little while. Why vitamin C is not supposed to be something that you should take excessive of, or possibly could be getting from blood transfusion that kind of came from somebody. If you are having a surgery, or for whatever reason your blood is having an issue and you need transfusion, it possibly can boost up those irons. Oh, in regards to the genetic, there are some people who have one of the bad gene. It's called a HFE gene. Um, it's kind of runs in the family, like it's a genetic. So if you have one of these bad genes, it's possible that you might have issues. Not necessarily, but possible. For people who actually have this particular condition, you really got to watch out what you eat. You got to cut the red meats because that carries a lot of iron. You got to cut a lot of the vitamin C. Vitamin C, what it does, vitamin C, it says it helps the body absorb iron um, a lot more than if you're not taking that many iron, vitamin C's. So you got to slow down on vitamin C, as well as the seafoods, the shellfish. Don't eat it raw. There are a lot of bacteria, and when iron overload, the body are very susceptible of catching diseases. Make sure you also avoid alcohol because, as I mentioned, it's really mainly coming from the liver. So alcohol will go through the liver, and if you have consumed too much alcohol, it's probably going to damage the liver more than it needs to be. Now, the other treatment is medications. Medication can expel these irons, but Medication is really not the first line. I was reading, it's kind of weird. Medication is not the first line of treatment. The first line of treatment is actually withdrawing blood from your body. If for people who have conditions like this, they're actually encouraged to, if they are they don't have any other medical conditions, they are encouraged to donate bloods. Otherwise, if people who are like me who have autoimmune conditions, um, they can I can go to the doctor and doctor can withdraw a pint of blood here and then a pint of blood in a couple of weeks until the iron level comes down, and then probably every few months, then withdraw some blood out to maintain the iron level. So, what change needs to be made if you have this condition? So, I actually mentioned a little bit about it a little bit earlier. Now, there's actually two types of iron. There's the heme iron, there's the non-heme iron, which I just learned recently. Now, the heme iron is much easier to be absorbed by the body, and usually where it carries more of the heme irons are, red meats, raw shellfish. Vitamin C will help absorb the iron a lot easier to the body, so it needs to avoid that. Um, so the non-heme irons are generally the one that is in the fruits, in the vegetables, like spinach and all the very green vegetables carry more iron than others, but they carry the non-heme irons. The body doesn't really absorb it that well. However, that's where the vitamin C comes in. So according to all the medical documentations, it says avoid vitamin C's. So the the body does not absorb these other non-heme irons as well. So normally doctors do not really do a test on irons unless when a person is not feeling well. Like recently, I was just a little weak, losing weight. So I had my doctor did a bunch of tests, including the irons. I haven't done my irons since probably 4 to 5 years already. My last test I was looking at 4 to 5 years, I was good. And prior to that was probably another 45 years ago. And I was actually a little bit low in iron deficiency during that time. I had to take some iron supplements. But again, doctor do not usually do blood tests on that. So I would suggest you ask the doctor to run maybe the iron test once a year just to check. And if anybody who has a little bit of iron overload, possibly get a genetic test from your family, which is actually recommended, and find out if the family actually have a history of that or not. If you actually have any symptoms, get your livers checked, get your kidneys checked, get everything else checked to make sure that everything else is okay. Now, I did run a blood test, not only just on the iron. I did run a blood test on, my kidney function, my liver function, liver panel. Pretty much everything actually comes back normal. A little bit dehydrated. Everything comes back normal, but for some reason, the only thing that is a little high is the iron. Again, I went to see a blood doctor, and again he looked at all these other results. He doesn't seem to be too concerning, so which actually gives me a little bit of a relief that I might not have the issue. Hopefully, in the next few months, when I redo the test, it will come back down. So for the meantime, I am avoiding a lot of the red meats for sure. I'm actually not eating any red meats. More fish, more salmons, all that. Vegetables, a lot more vegetables. Fruits and all that. And I'm actually slowing down on fruits as well because the fruits has a lot of vitamin C. So I'm cutting down. This is personally, I'm cutting down on that as well. Alcohol I don't drink because just because I'm actually I have a lot of medical issues ever since I was young. So and I've been on a lot of medicine. So and that doesn't really make. So I don't really take. I don't really drink alcohol. So yeah, that part I'm fine. Um, I did I mention get the family genetic test? Yeah, it's always good to find out if there's any history. Oh, and one other main thing is stop taking the multivitamiins and particularly iron supplements. I guess I mean, everybody thinks a little bit of the good thing is good. A little bit too much of a good thing, it looks like it might not be a good thing. So hopefully, in 3 months later, when I go back to see the doctors and rerun these iron tests, hopefully my iron level is okay. The earlier you detect the problem, the easier would get these problems resolved. Generally, many people do not have any symptoms. Even if you have iron overload, you probably do not know. Um, but again, recently I just have these body weakness, and that's why I ran these tests. Um, for people, who goes and do a yearly check, it might be good to just to run it. And if you're anemic, yeah, take some iron supplement. There's iron, a little bit iron overload, cut down on whatever you need. And if it continues on, get treated. Doctors said it's very easily treated, and there shouldn't be any problems. Run some bloods out, or if you cannot, then they'll give you some medication to take it, and the iron level should come down to normal, and then everything should be fixed. So hopefully, this gives you an idea of what this condition is. That's all for this particular video. Thank you for watching. Again, I'm not a doctor, not a professional. It's something I actually experienced recently, and I wanted to just kind of bring it up to, attention that there is such a condition out there. Too much of a good thing might not be good. So, yeah, if you have any, medical condition, medical questions, please reference to your doctor. Ask them for advice. Thank you so much. Thank you for watching. If you like my video, please subscribe. I'll have more medical videos coming out. Thank you so much. Bye bye.